Hello, my name is Dr. Gupta. I am a partner at Nova Orthopedic and Spine Care here in Woodbridge. My specialty is predominantly hips with some knees as well. And I've been using ortho laser now for approximately 1 year. I find ortho laser very helpful for my entire patient population. I usually divide up into three different areas. The first is those with chronic pain. So I'll see patients with chronic bursitis and chronic hip arthritis typically. For bursitis, it's been working great. Traditionally, patients were doing physical therapy as well as getting cortisone injections into their bursa every 3 months. What I've noticed by incorporating ortho laser in with these two other modalities, most of the time the pain completely goes away, or B, it requires them to take less cortisone or less frequently, which, as you know, is not beneficial to tissues over the long run. So it's been really important for me treating my chronic bursitis patients. For those patients with hip arthritis that either aren't candidates for surgery or want to delay surgery, again, I do this in conjunction with cortisone because the laser light therapy uses a different pathway than cortisone. They're both anti-inflammatory, so you get a really nice effect in combination, which I think is very helpful. With regards to the acute pain patients, that's the second group. Those patients that come in with, a sudden onset hip or knee pain or ankle pain after they fell or twisted a joint. The way ortho laser works for these patients is it really helps decrease the immediate pain and swelling. And so it's usually a shorter duration. However, if you combine that again with physical therapy with the RICE protocol, rest, ice, compression, elevation, it really has a synergistic effect to really help decrease the pain and get patients back faster. And then lastly, I've incorporated ortho laser for all my post-op patients. And I found it really helpful to help decrease post-op pain and swelling, number one. Number two, it really helps with the scar. So it really decreases the swelling around the scar, but also how visible the scar is. And then lastly, when I compare my patients, for example, where I've done a hip replacement with and without ortho laser therapy, they always say that it just gets them back faster. And again, this is usually a shorter course in conjunction with physical therapy, but again, very valuable. So overall, I think ortho laser has been a very helpful modality for my practice. I use it in combination with lots of other modalities that I've been using already. It's a great tool to have. It's non-invasive. You don't see it, you don't feel it. It's dose dependent. Keep that in mind so you won't notice anything right away. Typically after about 4 or 5 or 6 doses, depending on what the underlying diagnosis is, you'll start noticing a difference. Hopefully you'll really enjoy your experience here at Ortho Laser.